Hello, my name is Mary Kleiss. I'm a physical therapist with ActivePT in Sports in Rochester, Minnesota. And I'm here to present a presentation about something that not many people like to talk about, and that is incontinence or peeing while running, coughing, sneezing, laughing, or any physical activity. So I'm just going to get started with the presentation. And if you're joining us on Facebook Live, please feel free to ask questions and I'll do my best to answer them. Otherwise, you can contact me. My contact information will be at the end of the presentation. You can email me or call the number that I'll share at the end of the presentation. Why do I pee when I run? And other questions from runners. First, a little bit about me. I am a graduate of Mayo Clinic School of Health Sciences and a physical therapist at ActivePT in Sports. As a pelvic floor specialist, I've been trained in evaluation and treatment of pelvic floor conditions. And this is my colleague, Heather Dunphy. She also is with ActivePT and pelvic floor specialist, and together we make up the team at ActivePT. ActivePT has 7 locations in Rochester and surrounding communities, but we also offer telehealth services throughout the state of Minnesota. And our main goal is just to help you reach your goals. So we'd love to have the chance to help you out. Feel free to contact us. Also, I'll be providing some information in here that should not be considered as advice for you specifically. So contact your healthcare provider before you start any new healthcare regimen, including exercises. So today we're going to talk about leaking or peeing with activity. It's common, but it's not normal, and it has multiple causes. We'll talk a little bit about the anatomy of the pelvic floor and talk about the relationship between breathing, posture, physical activity, and pelvic floor muscles. We'll talk about why you may pee when you run, as well as talk about options for treatment. So it really depends. There are several different times during a run that a person might have urinary leakage. So be wary of anybody that offers you a one-size-fits-all approach. Sometimes it can be poor control or timing of the muscles that control the urinary system. It could be weakness, but it also could be tightness. Pain also can be an inhibitor of these muscles. Pelvic organ prolapse is a condition that happens sometimes with after having children, or if you strain too much when you're having a bowel movement. And then posture and running gait pattern can also contribute. So if your problem is not only with running, you're not alone. It's called stress urinary incontinence if physical activity, a cough or a sneeze or a laugh, causes you to leak urine. Urge urinary incontinence refers to the condition where you feel an urgency and you just have to go right now, and sometimes leak before you can make it. Mixed is a mixture of these. You can have increased frequency. You should be able to hold it for a couple of hours. And then sometimes people have to go at night. And if you're under the age of 65, you shouldn't have to get up in the middle of the night to go. Pelvic floor physical therapy can help if the muscles that control the urinary system are not working properly or have just a poor coordination or timing. So we can help you with that. Now, the other people ask, is it just me? And it's not. While it is a common condition, it's not normal. But about 30% of adult women report urinary incontinence, but I've even seen all the way up to 80. And the studies vary based on population and of the study and then the method of reporting, because it is such an embarrassing condition that some people just refuse to report. Approximately 25% of female high school and college athletes experience incontinence during their sport. 15 to 80% of female athletes report it, and it's highest with high impact sports and with those who have a high training volume. But unfortunately, about half of women don't report their symptoms to their healthcare provider and therefore don't get help. And 28% find urinary incontinence barrier to exercise. So what is the pelvic floor? So this is a little bit about the anatomy. You can see in the pictures the pelvis, and then on the blue pictures here are the ligaments that support the pelvic organs. And then on the left in the pink are the pelvic floor muscles. And these muscles really work for several different reasons, for several different functions. They help with breathing, they help with core stability, they help with bladder and bowel function, as well as sexual appreciation. And so this is a really important part of our system. And if they're not working properly, we can have several different conditions, including incontinence, pain, or other conditions. So other people will say, can I just do Kegel exercises? And again, this is an example of one size does not fit all. So first of all, research shows that not all women perform them correctly, even if they've been taught how to do so. 49% in one study performed the exercises after receiving written or verbal instruction, and they did it correctly. But 25% were doing the opposite and actually contributing to incontinence symptoms. And then also, not all weakness is due to strength. Tight muscles have difficulty with force production. And so if the muscles don't have the full range of motion, they're just not fully able to do their job and to perform that with control. We can also have poor timing and activation of the muscles. And then, like I said, pain can also be a strength inhibitor. And then finally, high impact activities is associated with an increase in intra-abdominal pressure, and that just is the pressure in the abdomen that is controlled by the diaphragm and the pelvic floor. And so the pelvic floor muscles require coordination, speed, strength to counteract these forces that occur during running and jumping activities. But in case you want to know, how do I do a pelvic floor contraction? I always get people started with training with breathing. You'll inhale, and with that inhalation is a relaxation of the pelvic floor. The diaphragm descends into the abdomen, and at the same time, the pelvic floor also descends to prevent an increase in intra-abdominal pressure. So inhale, relax your pelvic floor, and think about dropping all of those muscles that are in your perineum, between your pubic bone and your tailbone. And then when you exhale, you'll squeeze and lift the pelvic floor muscles. I always have people begin training lying down because that's not against gravity. It's just easier to coordinate and begin to access those muscles. And then you should progress to other positions because we do not live our lives lying down. So as your coordination improves, I encourage you to train sitting and standing and then with different activities. So adding movement adds further challenge, but you also should think about not only coordination with breath, but you also should be able to think about endurance of the pelvic floor muscles, being able to hold them for up to 10 seconds, and then speed of activation. And you'll want to progress to activation and holding during different impact activities. Now, I have had questions where people have said, well, how many should I do? Sets, reps, things like that. So the research that's been studied anyway, they always come up with a number, and it's 3 sets of 10 10-second holds would be the goal of where you would want to go for the endurance contractions. And then for the other ones, the speed contractions would be training relax, contract, relax, contract. They're about 1 second contractions. And those are really helpful for preventing urgency symptoms and things like that. So doing 3 sets of 10 of those as well is helpful. But I often have people begin with diaphragmatic breathing and the coordination of relaxation of the pelvic floor. And if you can get 10 minutes of diaphragmatic breathing in a day, that would be really helpful for reducing stress and many other conditions that benefit from diaphragmatic breathing. Here is an important takeaway, and if you hear nothing else from this presentation, please remember that relaxation is as important as contraction. Avoid overtraining because, like I said, sometimes leaking while running or with any other activity is due to overactive pelvic floor. Make sure you're doing your practice correctly, and if you have questions about that, make sure that you contact a pelvic floor specialist for assistance as needed. The muscles should fully relax between each contraction, and there should be a squeeze and a lift with each contraction. I also get this question a lot. Do I have to stop running? And again, it depends. Some research shows that running can benefit pelvic floor muscle training because there's an activation of the pelvic floor prior to heel strike and then also during the stance phase in running. Both continent and incontinent women demonstrated this pre-impact reflexive activation. The activation was higher in this study of the pelvic floor during running than just an active standing contraction. So it can be used as a training tool. But again, like I said, it really depends on where you are in your pelvic floor abilities. If you're asking whether you have to stop, I would ask you back, what are your goals? And have you had a recent injury to the pelvic floor, such as childbirth, trauma, or surgery? And do you have any other injuries, and are you experiencing pain? So how can you begin? It begins with breathing. The diaphragm, like I said, contracts to draw air into the lungs, and the pelvic floor relaxes. And this is a really great video that a colleague shared on Instagram. And I'm not going to play the video because I get stuck in a limbo of not being able to get back to share my screen. But if you see on the left, chest breathing and pelvic floor excursion and range of motion is much different than it is with belly breathing. And with a deep belly breath, the pelvic floor is encouraged to give its full reflexive relaxation. So diaphragmatic breathing also has been shown in studies to decrease blood pressure, stress, back pain, and then, like I said, to allow that full range of motion of the pelvic floor. So remember, inhale, relax, exhale, contract, and avoid holding your breath. Also, when you are running and throughout the day, avoid holding this Kegel contraction or the pelvic floor muscle contraction. Allow your body's natural reflexes to do their job because relaxed muscles are better able to activate. Release any tension in your jaw, in your shoulders, in your gluteals, in your core, because holding tension anywhere can contribute to leaking. And then, yes, I do have more tips. You can also manage your impact forces during running. Soft landings decrease that amount of impact forces and intra-abdominal pressure during the run. You can avoid overstriding and introduce a slight forward lean for forward momentum, as well as this reduces the heel strike impact force, which has been shown to contribute to leaking during running. You can strengthen your hip abductors and external rotators, as well as your core, your balance muscles, and then your pelvic floor, ensuring that squeeze and lift. For runners, I usually like to recommend single leg activities, and then multiplanar just means in different directions, and plyometric drills. So some strengthening exercises that you can do, begin with a gluteal bridge progression. Start with a double leg, and then you can progress to doing a march and a single leg bridge. When you can control keeping the hips level. So if you're wobbling during your bridge, it's not time to progress. So you would cross your arms over your chest to add progression and difficulty within each option. But then as you progress, you may need to put your legs back or your arms back down at your side. And then finally, you can add pulses to increase difficulty and increase the resistance during your training. A single leg squat is another excellent exercise. If you keep the standing knee pointing straight forward and keep the rotator control of the hips, keeping that knee as if it's a headlight pointing straight ahead of you. I want you to keep your hips level and avoid leaning to the side when you do your single leg squat. Press through the standing heel, activates the gluteals, and then keep your balance. And if you can't keep your balance at first, you still can do the strengthening. Begin with just a finger touch or a toe tap on the ground with the opposite leg. And then progress to being able to do this with no assistance, because obviously when you're running, you're in a single leg stance and you're going to have to push off with good hip rotator control and stability with no assistance on your upper body. So that's a single leg squat. You can also do a bird dog. This is a picture of the bird dog right here in the first picture. She's just in a 4 quadruped position. And then I begin with having people begin with just a leg out or an arm out. And then when you can keep the control of your pelvis with keeping from rocking, then you can progress to lifting the leg. Avoid arching your back and really keep the core stability as you strengthen those gluteal muscles. And then finally, standing hip circles are a great exercise for balance as well as for activation of the hip abductors. And you can even add a kickback to progress this for some hip extension as well. So that's the bottom picture. And then finally, is there more you can do? Yes. If you have pelvic organ prolapse, you can use a device called a pessary, which can be fit for you by a gynecologist or an obstetrician. Or you can get an over-the-counter product such as the Poise Impressa or the Revive. You can also consult a pelvic floor PT, because we can help you with evaluation of the tone, your contraction, your relaxation, and coordination of your pelvic floor muscles. And then we can help you to progress activation during different activities, which can help you with coordinating during with your running and impact activities. So please, these are some takeaways. You are not alone, and we should stop avoiding talking about this. I'd like you to talk with your friends about it, and moms and sisters, and just recognize that you're not alone and that help is out there. Begin with breathing. Control your breath. If you can control your breathing during running by improving your capacity of your cardiovascular system as well as the capacity of your pelvic floor, you can gain a lot of control and ability to prevent leaking while running. So relax the pelvic floor and allow it to do its job. Control the impact forces, like I said, with decreased heel strike and avoiding overstriding. And like I already said, improve your capacity to run and of your pelvic floor. Strength and control. You can strengthen your hips, glutes, and core, and then get help if you need it. Pelvic floor physical therapy, like I said, is a specialized field within physical therapy that treats men, women, and children with incontinence, pelvic pain, tailbone pain, pain with sex, pelvic organ prolapse, constipation, or back, hip, or SI joint pain that has not improved with traditional treatments. Here's some information about how you can contact me or my colleague, Heather. We are at ActivePT in Sports, and you can reach us by email, or you can schedule a free screening appointment either in the clinic or via telehealth video visit to talk to you about what you've been experiencing. And I encourage you to contact us with any questions you might have. Thank you so much for your time and your questions, and I look forward to hearing from you.